everyone once again. Dr. Alalade here at Ask the Gynecologist. So we are live on YouTube and we are also live on Instagram. I'm trying to bring up the live show on Facebook, and tonight we'll be talking about HSG. So we are live on YouTube. We are also live on Facebook, and as usual, we are live on Instagram. Sorry, I think I've got a bit of issue with the Instagram one. Anyway, we're getting ready. I want to first of all greet you all. Good evening. My name is Dr. J at Ask the Gynecologist, and it's going to be an amazing time today. The discussion tonight is on HSG, hysterosalpingogram. And if you're free, let's come together and have a wonderful time together discussing this very important topic, hysterosalpingogram. A lot of people do get it confusing, they get upset about HSG, and they get apprehensive whenever they are told to go and do HSG. But you need not to be afraid once you understand what HSG is all about. ATG, it's a Facebook program originally, but now we are simultaneously on YouTube, as you can watch me here on this handle, and also on Instagram and on Facebook. We broadcast all simultaneously on our 3 platforms whenever we go online every time. And I want to wish you good evening, happy midweek, happy Wednesday to Oluwajuwon Lokolade Oyekome. Sorry, I'm coming out a bit late tonight, but it's better late than never. And yesterday we were on live. Yesterday was a time I got settled in back into UK. You know, I've been in Nigeria for the past 2 weeks, and I spent time consulting at the ATG IVF Center. My sister Tola, my wonderful sister, how are you? Noble Queen, UK, Jennifer Osula, Messiare, Motula Mulenga on Instagram, Onyimiki, Sophia Wilson, Nosagowa Moeti Iroa, Tosin Okusonya. So once again, I want to wish you all good evening. And most importantly, I want to celebrate all the ladies that support our program, all my friends, my wife, most importantly, my mother, and all our ATG members out there. My purpose in this world, by the grace of God, is to ensure that we make and enable women to achieve their full reproductive potential. Not only that, to achieve their best and to consistently fulfill their goals. That is my vision. That is my mission. And through ATG, we are slowly, consistently, and fastly achieving this purpose. And by the grace of God, we will not relent. We'll continue to do so as far as God has given us the grace. Once again, I want to welcome you all to this show. My name is Dr. Lalade, and it's my joy to be your anchor today. Miriam Ukeba, how are you? There's a question that does removal of both tubes cause weight loss? No. Removing your tube, removing your fallopian tube, maybe for any reason, medically or for whatever reason, has got nothing to do with weight loss, okay? Idin, hey, blessing. How are you, my sister? In this kitchen, Idioma 9695, Ani Edashi, Lucy, Umi, Adesunloye, Oluwafunlola Elizabeth. Good evening. Onkume Chinenye Ebene. How are you? Linda Okoye Udemba. Good evening. Now, HSG, as we all know, is hysterosalpingogram. Hysterosalpingogram. HSG is strictly an X-ray test. To do HSG, it must be done under X-ray. And HSG is to check if there's any blockage in your tubes. Sometimes HSG can even unblock whatever is causing blockage in your tube. Apart from HSG checking if there's any blockage in your tube, to check tubal patency, HSG too can sometimes unblock and remove whatever is causing blockage in your tube. HSG is part of the investigation. Jamila too is from Ghana. How are you, my sister? Akwaba, welcome to this show. So HSG is originally designed to check if there's blockage in your tube. It's part and parcel of any infertility investigation. A lot of women are scared about HSG because they've been told by their friend that it's causing them pain. To be honest with you, up to 40% of women that go for HSG will have pain. Yes, because it can be very uncomfortable, especially if it's your first time trying to get pregnant and your cervix has never opened before. Sometimes it could be difficult in such situation to get the catheter of the HSG to go past the cervix. The cervix is the opening of your womb at the neck of your womb at the top of the vagina. If you put your finger into your vagina at the top, you will feel that soft thing like a rubber, okay? That is, it feels like your nose is the cervix. That is where, if your husband is pressing the clutch to the floor, that's where the man will hit. And when they are pressing the clutch, doing the bedmatics business, HSG is done to check if there's any blockage in your tube. So we pass the catheter through your cervix to get into your womb, and we push in a dye. I always carry this model of my womb or of these wheelchairs everywhere I go. Even when I was in Nigeria, I had one. And all our offices, we have this model of the womb to explain to people what it is. So HSG, we pass a catheter, okay, through your cervix, okay, through your cervix, and it goes into your womb. That catheter is a very tiny rubber substance. We're now pushing a contrast dye, and that dye goes into your womb cavity and it moves into the right tube here and the left tube on the other side. And the dye will pour out of your tube into your tummy on this side and also on this other side as well. Your body will reabsorb the dye automatically. But while the dye is coming out from your tube on this way, on that way, we take X-ray pictures and we see the dye coming out. Hello, Comfort Olagunju Asolo from Oshogbo. I was in Oshogbo as well in Dada Estate. While I was in Oshogbo, it was a wonderful time, and I was also at what do they call that place again? Okefia in Oshogbo, wonderful place, very quiet place, lovely weather and clear skies. So the dye will pour out in from your tubes on this side and on that side, and the body will absorb the dye, definitely. Okay, but while the dye is coming out from your tubes, we take X-ray and we can see if there's any blockage in your tube. So HSG is designed to check for patency or any blockage in your tubes. Okay, you go for HSG, it's paramount that we do vaginal swabs, because if you have any infection hiding in your vagina, we don't want to push them into your womb cavity at the point of HSG, and that could complicate things, making your infection hiding there that is contained there moving into your womb and tummy and causing PID. It's essential that you get swabs checked done before you go for HSG. Before going for HSG, okay, you must understand that they will report your report. And once they are reporting your HSG, the report will say there's bilateral tubal patency. What it means is that there's no blockage in your tube. Patency means open. We say there's bilateral means both, on both sides. That is our word in medicine. But there's bilateral tubal patency. Basically, both tubes are not blocked. If there's blockage, they will say why they've seen. Sometimes we see what we call hydrosalpinx, where hydrosalpinx means hydro, water, salpinx, tube. Hydrosalpinx means there's water swelling in the tubes. So if you have hydrosalpinx, it could be from a previous PID or previous infection, and it causes the tube to swell up, and the tube cannot allow egg to go through. That is to say, the tube is blocked. Another thing that HSG would give us information about is that during HSG, the way the dye fills your womb cavity, we'll be able to see and say if there's any abnormal filling defect. Sometimes your womb can be abnormally shaped. There could be a fibroid in your womb or some polyps there. If we see that there's any filling defect, we say, there's a filling. HSG will only suggest if such things are there. To be sure whether it is true, we'll now go and do scan or do hysteroscopy to see what is there or to treat what is there. Okay? When we say your tubes are patent, it means it is not blocked. If we say the tubes are not patent, it means it is blocked. Patent means no blockage. Now, HSG is, like I said again, it's an X-ray test. Sometimes, if you're going for HSG, the doctors or the radiographer cannot pass the catheter through your cervix. We say there's a blockage in your cervix, or your cervix is stenosed. That is to say, it's tightly or tight, and we can't get the catheter in. There are many options we can do to try to dilate and get the catheter in at a future time. It's important that if you're going for HSG, like I said again, you should get swabs done. About this, make sure that you get our PDF on HSG. We have a PDF on HSG, and you can always get it and read about HSG. Before going for HSG, it's important that you do your swabs, like I said. Check for any infection in your vagina, and also, apart from that, also ensure that you take some painkillers like buscopan, paracetamol, codeine, or ibuprofen, if that's okay with you. Take those painkillers at least 1 to 2 hours before going for HSG. If you've not done swab tests to check for infection in your cervix, or if you're not sure of the result of that swab test, it's important that you take azithromycin 1 gram after your HSG, or 1 gram before the HSG. Azithromycin 1 gram, it comes in 4 tablets. Each tablet is 250 milligrams. Put all the 4 together, it becomes 1 gram. You swallow that 1 gram, 4 tablets together as 1 gram after the HSG procedure to reduce any chances of infection, because you cannot take anything for lightly. There could be some infection hiding in your vagina. You don't want to push it in and cause more problems. Now, if you've done HSG and we said there's block in your tubes, there are many options. The first option sometimes could be to repeat the HSG if that's with you. But if we're not sure, we want to proceed further, we can do what we call laparoscopy and dye test, especially if we have difficulty in doing HSG, and if we can say, or we think there's a cyst in your ovary that we want to treat at the same time, we can do laparoscopy. Sometimes too, if we suspect during your HSG that there's a fibroid or polyp or some funny feeling defect in the womb. Now, like I said again, HSG can be very, very uncomfortable for about 40% of people. So it's essential that regardless, if you need HSG, go for it. Go for it if you need it, but ensure that you take painkillers, buscopan, codeine, or paracetamol together, if possible, if you need, before going for the procedure, so that you'll be comfortable during the procedure. Okay? Now, HSG, you've done it. It says you got blocked tubes. We can do what we call hydrotubation. Personally, I don't believe in hydrotubation. Hydrotubation is done to flush any blockage in your tubes. We use fluid under pressure. We push it into your cervix, into your womb cavity, to see if we can unblock the tubes. Let me tell you something. If your tubes are blocked after your HSG, okay, and HSG has confirmed that there's blockage in your tubes, hydrotubation is unlikely to work, because it works only for about 4% of people. 4% is very, very low. If HSG has been done for you, your tubes are blocked. If indeed the tubes are blocked and they will be open, HSG is enough to open it. If after your HSG, still we say the tubes are blocked, hydrotubation, you can try it, but in most cases, it doesn't work. So if it doesn't work, don't panic. Now, if it doesn't work, hydrotubation, option will be, to be honest with you, to consider IVF. I'll tell you the truth. Because once we've confirmed that both tubes are blocked, we have to find a way of bypassing the tubes. The egg you release, okay, from this ovary, it can't enter the tube because the tubes are blocked. If it enters into the tube, it's going to get stuck along the line. So we have to bypass the tubes, and that way is to bypass the tubes by doing IVF. So if the egg that enters into your tube cannot go through the tube and get into your womb because there's blockage in your tube, we have to seriously consider IVF, honestly speaking. Now, there are many reasons why the tubes can be blocked. Many reasons. It can be blocked from infection, previous operation, previous PID, previous ectopic pregnancy. It can be blocked from endometriosis, can be blocked from fibroid. Sometimes you have fibroid around the tube entrance, and that fibroid is compressing and blocking the tube from opening. So anything can cause tuber blockage. It's not because you've been wayward. It's not because you've been having sex. No, sometimes you just have a fibroid that is all over your womb, compressing your tubes, not allowing the tubes to open and empty into the womb. So anything can cause tuber blockage. It might be infection that was not treated, infection that you never knew you had. So don't panic if you've been told that your tubes are blocked. There's always a way out. Chinwa Okeke, all the way from Scotland. Gozie Kene, thank you so much. Mary Cielo, thank you, my sister. And the wonderful lady, Sophia Wilson, is it? She's asking the question, what causes swelling of the walls of vagina? Usually from infection, from thrush. Thrush infection, which is yeast infection, can cause discomfort, swelling, severe pain, and swollen vaginal wall. Yes, sometimes too, a lack of lubrication during sex can cause swelling and pain in your vaginal wall, but in most cases, it's an infection. What causes irregular menstruation? That is a very common question on our page here. Irregular menstruation is usually caused by hormonal imbalance. The first cause of irregular menstruation is usually hormonal imbalance, followed by infection. Okay, Abosede Ajoke, the way forward is for you to do all your hormonal tests. Once you've done your hormonal test, we will know which one is at fault, which one can be fixed. And I always tell people on this page, there's always a lab for you, close by you, reputable lab. But if you don't have any lab reputable in your area, please ensure you come to HSG laboratory. Our laboratory is fitted to do all your hormonal profile tests. The HSG laboratory is at Alimo Osho Agege, and address is already on your screen. Come there, get all your infertility tests done at the HSG laboratories. Angela, Tubua, Soa, Anyawu, Obi, Blessing. It's Chi Baby, Onye Chi Steven. Now, if you need IVF, okay, IVF comes in about 4 ways or 4 stages or 4 ways. First of all, if you're doing IVF, you can use your own eggs and your own husband's sperm. Another way forward is to use your husband's sperm and use your own donor egg, or use your own egg and donor sperm. Sometimes, to number 4 is to, some people will say they want to do gender family balancing, they want to do screening for genotype, they want to do a freezing of the egg, and so on and so forth, or freezing of the embryo. All this is they are extras, okay? So IVF could be you using your own eggs and sperm, you using donor sperm and your own eggs, or using your own sperm and donor egg, and sometimes other cosmetic things. So you should understand. So when people ask me on this page, doctor, what's the cost of your IVF program at the HSG laboratory? It's not one price, because it depends on your story, depends on your peculiarity, and on your journey. Remember, I told you that a foundation has decided to fund IVF for 20, I think it was 25 people, if I'm right. I can't remember again, to fund about 20 people or so for IVF, and they've offered to pay 25% of the IVF cost. So if you're in Lagos, you are in anywhere in Nigeria, you want to do IVF, that foundation, they want to remain anonymous, and they want to sponsor people and give them 25% cutoff for their IVF procedure. If you want to take advantage of it, call our office tomorrow and start your journey for IVF if that's what you need. If your tubes are blocked, IVF is the way. If there's no sperm in your husband's semen, you've done everything, you consider IVF. If there's no sperm, and you want to consider surgical sperm aspiration, surgical sperm collection, you can come to our center, you'll be looked after. Or you want to freeze your eggs or freeze your husband's sperm, come to our center, HSG IVF Center, you'll be looked after. Not only that, when at the HSG IVF Center, all our systems are 24 hours. Solar panel, 2 servicing generators, and an inverter bank, so that there's no disruption in power supply. At the HSG IVF Center, we've invested so much on energy so that there's no disruption, and we get the best, and we keep all our cold chain and incubator at steady temperature and pressure. So ensure you start a journey. You can call the office tomorrow, speak to my secretary Nike or Dr. Chioma. You will be looked after. And if for any reason you've done IVF somewhere else, it's failed before, it's your time to start a journey with us. You have tubal blockage, ovarian failure, or maybe of your ovaries, you are not working as supposed to be, or you need to do surgical sperm collection to get you pregnant because there's no sperm in your husband's semen. It's time to start the journey. Help is here. Your journey starts tomorrow. Your journey starts now. Today is a day of salvation. Now, good evening, doctor. What is the age limit of IVF? To be honest with you, there's really no age limit for IVF. But as you get older, success of IVF starts to drop. As you get older, IVF success rate starts to drop. For the 5 years old, Using your own eggs for IVF is not very, very promising. You have to consider egg donor, especially if you're above 40. Above 45, egg donor, to be honest. Above 40, start considering egg donor, okay, for IVF success. Debbie Forever, Talk Interior, CC BIP 26, Fala Beauty 79. And also here on YouTube, we have people watching. And we have Fedoha on YouTube. Thank you and good evening, my brother, my sister. How you doing? Uche Ojini Nwabichi. Oyedupe Abigail. Once again, Abigail, you're welcome to this show. We love you. We like seeing your name. Isukariari Frida. Longest time, my sister. I was online yesterday. I've been in Lagos all last week. It was hectic to sit down to even do any live show. After you've been consulting for the whole day, you want to get some rest. Honestly speaking, I thought I was on vacation in Nigeria. Actually, I was working harder than I was working in UK. Nigeria was busy, but all glory be to God. I'm grateful for every couple that I saw at the ATG IVF Center last week. Thank you so much for your patience, for attending, and I pray that God Almighty will use us as instruments of bringing joy and joyful bounties to your home by the grace of God. Can significant fluid in the PID be drained? If you have fluid, okay, in your part of Douglas, okay, it does not necessarily mean that you have PID. If we see fluid in your part of Douglas, we need to interpret it in a context. For example, if you just ovulated, okay, you're just ovulating, you ovulated yesterday, there will be definitely fluid in your part of Douglas. If you had a cyst before that just ruptured, there will be fluid in your part of Douglas. If you have ectopic pregnancy that is dangerous and an emergency, ectopic pregnancy, you will see fluid in the part of Douglas. If you have an infection, okay, you see fluid in the part of Douglas. So, but everything would need to be interpreted in context. So if a lady comes to me, okay, if a lady comes to me today, she ovulated yesterday, she's not having temperature, no fever, no offensive discharge in the vagina, it's likely that that fluid in the part of Douglas is just from the ovulation. But if a woman comes to me, she's suspecting a ectopic pregnancy, we are seeing bleeding, she's pregnant, we can't see pregnancy, we suspect that the fluid in Douglas, in that part, is from ectopic pregnancy, an emergency. If somebody comes to me, she has temperature, the vagina is smelling terrible, and she's having pain in the lower abdomen, in the lower tummy, it's likely that she has PID. I want to take swabs and start antibiotics treatment. So we interpret what we see in a part of Douglas with just clinical history. We won't just say because they have fluid in the Douglas part of Douglas, so it's infection. No, we can suspect infection. If we do swabs to conclude if there is an infection there or not. But just simply because there's fluid in the part of Douglas, that doesn't always mean that you have an infection. I hope I'm making sense. Omaiho, Esho, Fali, Olabisi, Olawale, Eze Ruth Chiwendo, Judith Malta, Fasonu Omotosho Yemisi, Rodieti, Gift James 80, Madubu Guchidi, Onyek Okiere 6515, Adeoshuna Deshawa, Nen. How are you, my sister? And welcome once again to this show. We are discussing about hysterosalpingogram, HSG as a test to see if there's any blockage in your tubes, which can sometimes unblock any blockage. If you have HSG done and there's blockage in your tube and HSG cannot clear that blockage, it's unlikely to be cleared on its own. You might need IVF. Okay? So HSG itself is a test of checking if there's blockage in your tubes, and sometimes invariably too, it can also help to remove any blockage in your tube if there is a blockage there. So I tell people all the time, if you've had an HSG done, which is successful, and every other thing is fine, you're ovulating, your husband's sperm count is good, you're having regular sex, we've done your HSG, everything was okay, it's okay. I tell people all the time, start having regular sex, because I've seen many people, they got pregnant just after HSG. That means that whatever is blocking the tube might have been cleared during HSG. So if at all, if anything will make you do HSG, the fact that it might unblock your tubes if they are indeed blocked. So I know HSG is painful, it's uncomfortable, but it might be just what you need to change your story and to change your story to positive. What causes something like growth in the mouth of the cervix and what can be done. I don't know what you mean, but maybe you mean you have what we call cervical polyp. If it's cervical polyp or fibroid on the cervix, nobody knows what causes polyp or fibroid on the cervix. But if it's there, we take it out, we send it to laboratory to see if there's any unusual thing there. And if the lab people say there's nothing there, it's been treated, case closed. But it's essential that I use this opportunity to say that if you're a lady and you are between 25 years old and 54 years old, ensure that you do cervical smear test every 3 years. If you haven't done a cervical smear test before, it's high time that you go and get your swabs done. That's your cervical smear. Get it done at the HSG office tomorrow. If you've never done cervical smear test before, get it done at our office tomorrow, because you don't want to risk it. The easiest way to know that there's no cancer or cancer cells in your cervix is by having your cervical smear test done every 3 years. And you can get that done at the HSG office, HSG laboratories tomorrow or at any time. Just call and get booked. Akinsuliwe Olwedamilola Kemi, Otele Saigon. Yes. Can somebody help me forward our address to Mr. Otele Saigon, our office address? Mosomola Tomini, Igwe Lilian Onyechi Okoye, Ekemena George. Your test results say that you have chronic infection, fluid seen in your right tube. So you need to get swabs done to know what this infection is, so that we can prescribe for you specific antibiotic to treat this specific infection. I don't like guesswork. So if you have an infection in your tube, you need to do swabs to know what specific bacteria or infection is causing this infection in your tube. J1 Ultimate, good evening, my sister on Instagram. How are you, J1 Ultimate? Thank you so much for this. Like I said again, it's a company that has given us a link that if you are in the diaspora, UK, America, Dublin, or Europe, and you had previous stillbirth, previous miscarriages, stillbirth, if you're pregnant, you should be on cyclogens for the first 12 to 14 weeks of pregnancy. And they've offered that they can get you a cyclogens delivered to you. So if you want cyclogest, progesterone delivered to you, if you are in your pregnancy, you've had miscarriages before, you've had a stillbirth before, you should be on cyclogest for the first 12 to 14 weeks of pregnancy. And in that case, you can get it delivered to you if you are not in Nigeria, if you're in the diaspora, you are in the UK, Dublin, America, Canada, you can get it delivered to you. All you just need to do is to let one of our moderators know, and they will give you the phone number of that company. It's a Telegram number, and they will send you the link to get delivery sorted. You have a regular period this month. You're supposed to see your period on the 7th of this month. You've not seen it yet. You went to the hospital, nothing happened. So give yourself 7 more days from your expected period. Okay? If your period is supposed to come on the 7th, today is 9, give yourself 5 more days. If nothing has happened, reach out to me. Doctor, what is the normal FSH and LH for IVF? I don't know what you mean, but if your FSH is more than 30, you're probably going to need IVF and egg donor. Maybe that's what you mean. Why is someone confirmed almost 3 months pregnancy, but scan says the scan is empty? If you're 3 months pregnant, that's you're about 12 weeks, and you're sure, there should be something on scan. If they can't see anything on scan, okay, don't panic. Repeat the scan in 2 weeks' time. And if indeed you're pregnant, they will see something on scan. If they haven't seen anything on scan, my sister, what you need to do now is that do blood test of pregnancy. It's called serum beta quantitative HCG. Okay, that test of pregnancy called serum beta HCG, you get your result in numbers. And if it's more than 7, it means you're pregnant. If it's less than 7, you are pregnant. Okay, that's the best way. And if you go to the laboratory and tell them you want to do serum beta HCG of pregnancy, and they tell you, ask them, are you going to give me my result in numbers? If they say yes, go ahead and pay. If they say no, don't pay, because it's a waste of time. Okay, for this case, if you are indeed 3 months pregnant, your beta HCG test of pregnancy will be more than 7. In fact, it's going to be about 2,000 or more. Okay, is it advisable for a woman having high blood pressure to get pregnant? I would suggest, if you have high blood pressure, first of all, get treated. get your blood pressure controlled, or your diabetes controlled, asthma controlled, okay? Anything you have, medical problem, get it stable and controlled before you embark on pregnancy. Pregnancy itself is a stressful journey. It makes things difficult. So if you don't have adequate control of your blood pressure, you want to get pregnant, the first thing you gotta do is to control your blood pressure, control your diabetes if you have, control your asthma, control your epilepsy, get them stable. See your physician for that before you embark on the journey of pregnancy. What's the difference between adotubation and HSG? Adotubation is specifically designed to unblock the tubes. HSG is a test to check if there's any blockage in the tube. HSG is an X-ray test. Adotubation is not a test. Adotubation means that you already know that there's blockage in your tubes. We want to unblock it. They will do adotubation. But I don't believe in adotubation. It only works 4 out of 100 people. Okay? Akwara Chukwuebuka Joy needs the address of our ATG IVF center. Can one of our moderators please help me give Chukwuebuka Joy the address for our ATG IVF center? Please start that journey tomorrow. Is there any advice for an ulcer patient trying to get pregnant? Just ensure you're taking your ulcer medications. And if you're on any ulcer medication, let your doctor know, looking after you for your ulcer, that you want to plan to get pregnant too. Is all your medications safe for pregnancy? If they are not safe, they'll convert you to your ulcer medications that are much safer for pregnancy. And in fact, most people that have ulcer, their ulcer actually gets better and does not cause them any problem during their pregnancy. Just funny. See how nature works. Does high prolactin cause infertility? Yes. If you have high prolactin, it will make you not to ovulate. And if you're not ovulating, it becomes difficult to get pregnant naturally. I can join ATG antenatal. Can somebody give Lovett Roberts the link to join the ATG antenatal service? Why after 3 months of scan, the doctor advised evacuation because baby did not grow well? Okay. The fact is that if you've done scan and you can't see pregnancy at 12 weeks, that's 3 months. My first advice is don't rush. Repeat the scan in 10 days. If there's still nothing on that scan, that means there's no pregnancy there. The pregnancy is miscarried, what we call miscarriage or missed abortion. In such a case, the best way forward will be to consider evacuation. Okay, that's the way it is. Doctor, what causes missed abortion after 7 weeks? Honestly, we don't know. But in most cases, it's either infection or chromosomal abnormality. Sometimes the pregnancy is not forming well because of things that are beyond our understanding, and then it results to miscarriage. If you understand pregnancy, everything must work hand in hand. Any mistake during implantation of pregnancy can cause miscarriage. What is the natural way to treat ovarian cyst if the pain is too much? The natural way to treat ovarian cyst is to remove it. The natural way to treat ovarian cyst is to remove it. If you have ovarian cyst, it's causing you pain, remove it. There's no medication that I know that can dissolve ovarian cyst. If you got ovarian cyst, it's more than 4 centimeters, the best thing to remove it through surgery. Okay? If it's less than 4 centimeters, you can and it's not causing you pain, you can rescan about 2-3 months down the line to see if the cyst is getting bigger or not. If it's not getting bigger, leave it alone. If it's getting bigger, take it out. My number, I can't put my number on this screen. There's no way. I can only put the number of my office, which is closed now. Our office opens 9 a.m. weekday, Monday to Friday, and they close by 5 p.m. Monday to Friday. On Saturday, they open 9 a.m. to 2 p.m. Okay, and the number of our offices, they will be on the screen shortly. Can one of our moderators please help me post the number of our offices, please, because somebody needs that number. Can a long implant that I don't understand? David, can you please post or retype your question? Let me be able to read it. Don't give me a headache now. Make it easier for me. What causes blighted ovum? Honestly, we don't know. It's usually an infection or failed implantation or chromosomal abnormalities that can cause blighted ovum, but we don't know in most cases. Okay. Rita Elia, how are you? Thank you so much. If I've missed your question, put it up again. You know I'm human. Before I read a question, another one come up on the screen. So I'm human. If I missed your question, ask them again. Fumlai Badamosi, doctor, can ovarian cyst cause infertility? Yes and no. Ovarian cyst, if it's blocking the tubes, if it's damaging the tubes, if it has caused twisting of the tubes on both sides, it can cause infertility. Remember, you only need one tube to get pregnant. As far as one tube is okay, and that one tube that you have is perfectly okay, that's all you need to get pregnant. One tube, okay? You only need one tube. And if you're ovulating from one, for example, now, if you've lost your, God forbid, this particular tube, okay, but you still got this ovary. You have this ovary, you have this tube, okay? This ovary can release egg. This tube will pick it up. This ovary release egg. This tube will pick it up, okay? Regardless, the leftover tube that you have that is working can pick up egg released from either ovary, okay? Peter wants my number. Can somebody help me give the my lady here, Peter in Spain, our link to subscribe to the premium services, so you can contact me through our HSG premium services. To treat hypolactin, use bromocriptine or Dostinex. You did swab, your results say you have a yeast infection. Then use Candida, clotrimazole, Candida. Treat it Candida with clotrimazole, okay? You're using antibiotics, it will make your thrush, your yeast infection worse. You're using antibiotics to treat yeast infection, waste of time. It will make your yeast infection worse. To treat yeast infection, you should use canesten or clotrimazole. Or if you're not pregnant, you can use Diflucan. Okay? How can you prevent blighted ovum? Honestly, I don't know how you can prevent blighted ovum. I don't. If I know, I'll tell you. I don't know. But in most cases, they don't happen again to you. Can I do IVF if you have hyperthyroidism? If you want to go for IVF, any medical problem you have, whether it's blood pressure, diabetes, hyperthyroidism, hypothyroidism, diabetes, asthma, ulcer, renal transplant, any medical problem you got, you must get them treated and stabilized and under control before you embark on the journey of IVF. 40-year-old with adenomyosis, you trying fibroid, can she get pregnant after surgery? Yes, indeed. Yes, indeed. So everyone, thank you. I know people are joining late. I know you're busy at work or somewhere, but we'll be on live for some few minutes now. I'm trying to round up shortly. Ajayi, how are you? MK, how are you? Fola Beauty 79, how are you so much? Good evening. Joy Opara, you have one tube and PCOS. As far as that one tube you have is okay and it's not blocked and you are ovulating, you can get pregnant. But since you have PCOS, get the PCOS treated, and then any other hormonal profile you have that is faulty, get it treated, okay? Difference between HSG and scan. Scan is ultrasound waves. HSG is X-ray test. HSG is done to check if there's blockage in your tube. Scan is done to check whether there's any fibroid or polyp or cyst on your tubes, or on your tube, on your ovary, or on your womb, okay? Aqua Chukwuebuka, you want the address to our office. Don't worry, one of our moderators will put the address to our office shortly on the screen, okay? Doctor, can additions cause infertility? Yes, additions can cause infertility. Is canesten harmful to someone trying to conceive? No. Canesten can be used before pregnancy and during pregnancy. The one that is harmful to baby or to pregnancy is Diflucan. You can treat your yeast infection with canesten. Canesten is safe before pregnancy, is also safe during pregnancy. The one that is not taken during pregnancy is Diflucan or fluconazole. Okay? Otele, Shygun, don't worry, one of our team members will give you the address to my office shortly. Okay? Thank you everyone for joining today. I appreciate you. I have to close down now, and I'll see you tomorrow, all things being equal. Much love to you, from me to you. I want to say most importantly, I love you all, and thank you for spending your time and data to listen to me today. To treat Staph aureus, they will give you a report, and in that report of Staph aureus, they'll give you the antibiotic that is sensitive to Staph aureus. But honestly speaking, Staph aureus is a waste of time because it's just a contamination during sample collection. But if you want to treat it, they'll give you a report sheet where you put the Staph aureus, so there you have is sensitive to this particular antibiotic, and they give you the treatment and it treats it. Okay, bacterial vaginosis, you use your metronidazole pessary or cream to treat it. Okay, thank you once again. Olajuwon from Middlesbrough, how are you from? You are the T side, the T side, the team T side. How are you from T side? Greetings to all of you in Middlesbrough at this St. James Hospital? No, something anyway. T side. I can't remember the name of the hospital again. But welcome to you, and thank you so much for been here. I've been there before, Teesside area, Middlesbrough. I've found a fantastic, fabulous place. And Rita area, all the way from Warri Delta. Our offices are in Lagos. Okay? Thank you. I hope to see you all soon. God bless you. Have a wonderful day. Bye-bye.